I'm Julie Zenner along with Dennis Anderson, and here's what's coming up on Almanac North.
Well, after 5 years of research, a study led by a UMD professor could influence the state of Minnesota's new sulfate standards in waters that support wild rice.
Residents in the Proctor School District will vote on a referendum next week that would upgrade athletic facilities, including building a new multi-sport arena.
And on the annual Go Red for Women Day, important information for women to keep heart healthy.
These stories and more coming up next on Almanac North. Hello and welcome to Almanac North. Thanks for watching. And Denny Spike the porcupine saw his shadow at the Duluth Zoo this week, so I guess that means 6 more weeks of winter.
I don't mind winter. I think as I've grown older, I've become so accustomed to living here in the Northland that winter is just part of life up here.
Yeah, I like it too. So 6 weeks, month and a half, who cares?
Doesn't matter.
All right, let's get to our first topic.
All right,
Thanks,
thank you so very much, Julie, and welcome everyone. Research conducted at UMD and in the Twin Cities will help set new sulfate limits for Minnesota waters that support wild rice. The Minnesota Pollution Control Agency is in the midst of re-evaluating the state sulfate standard, which is set back in 1973. The MPCA has proposed a new flexible standard for water bodies containing wild rice. A new standard could affect current and proposed mining projects in Minnesota. So here with more is John Pastor, a biology professor at UMD and lead author of that study. And John, thank you so very much for being here. How does sulfate affect wild rice?
Well, it turns out in our research it's not the sulfate that's the issue. When the sulfate, which leaks from the mines and sewage treatment plants and other places, gets into the wild rice bed, it gets into the sediment, and bacteria in the sediment where there's no oxygen they convert the sulfate to sulfide. Sulfate is sulfur with 4 oxygens around it, and essentially what they're doing is using those oxygens, kind of. And it's the sulfide, sort of a bare sulfur atom, that's toxic.
It kills the crop?
Well, it's toxic to the seedlings. And then some things happen at the mature stage when the plant is making seeds that we're researching now. It's a little more complicated at that stage, but it does definitely kill the seedlings. Our research has shown.
Specifically, what did you set out to find when you began your research?
Well, there were 2 things. Number one, determining whether it's sulfate or sulfide that was toxic. And we always suspected it was a sulfide, but we had to show that. That actually we did in a laboratory using hydroponic solutions, but we had to develop new hydroponic techniques for that. And so that wasn't easy to do, but in the end we showed that it was the sulfide. And at very low concentrations, so it doesn't take that much sulfate to produce enough sulfide to be toxic to the seedlings and to cause the seedlings to die even before they come up out of the water column.
Sure. So how important is the wild rice crop in Minnesota?
Well, it's quite important. It's important especially to the Native Americans that this is a staple, but it's also, I hate to say it's a sacred food. I don't mean to speak for them, but something like that. And it's very important to their economy. It's important recreationally. People go out all the time to harvest it. It's the state grain, so it's enshrined in our laws that this is our state grain, just like we have a state bird, the loon, and so forth. So it's an important part of what it means to be a Minnesotan, that you could go out and gather your own wild rice and, not in New York have to eat wild rice mixed with white rice and all that abomination,
There has been a lot of controversy lately with people being concerned about what some potential non-ferrous mining operations could do to the wild rice crops in our area. Based on your findings, Are those concerns warranted?
Yes, they are. Now, when these new mines are put in, they could be engineered in such a way that you could capture the water and treat it. And the treatment is expensive, but it could be done. Those mines can meet the state standard. The high price of copper on the market and palladium and these other things will presumably pay for it, and Polymet says they could do it. The bigger issue actually is the iron mines, which when they were first put into place, this wasn't an issue. The water is collected in the tailings pond. These ponds are not designed for treatment or anything like that. And so it actually becomes a bigger issue with the iron mines, even though the iron ore is lower in sulfur than the copper nickel ore.
Now, correct me if I'm wrong, but my understanding reading some of the literature is that your findings were that the current state standard is 10 milligrams per liter, and that the study found impacts on plant productivity at 50 milligrams per liter, which is much higher. So are the current standards more than adequate to meet the concerns if they were being enforced?
Yeah. The current standards protect wild rice. If you combine our data with field data that was collected by someone else as part of this project, Amy Mirbo in the cities, if you combine the two bits of data, the current standard will protect wild rice 80% of the time. Now, there's some times when you might allow a higher sulfate content. 50 is an interesting number from an engineering standpoint. The engineers say, if we have to go below 50, that requires a technique called reverse osmosis, which is expensive but doable. And the engineers tell me that if we have to go below 50, it might as well be 10. Going to 30 is not going to save you any money. You might as well bring it all the way down to 10. So 50 is kind of, from an engineering standpoint, a critical number. And when we showed that at 50, we start to see some effects. Definitely at 100 parts per million, we do see effects.
So, John, is there going to be a new standard then in the state, a new rule?
I don't know. I'm not part of the rulemaking process. The PCA is now figuring that out. They're trying some new approaches to making a new standard that will make it flexible depending on the amount of iron that's there, because the iron can precipitate the sulfide. That's what our current research is on. And what we're showing is that in the spring, the iron will precipitate some of the sulfide, and you will get better seedling survival. On the other hand, later in the growing season, the iron precipitates the sulfide on the roots of the plant when it's starting to make seed, and that blocks nutrient uptake, and those plants produce fewer seeds and lighter seeds.
So did the MPCA come to you and ask you to conduct the study?
Yeah, what happened was the legislature gave the PCA a pile of money and said, go work with someone. And the PCA called for proposals, and we put in a proposal for our team, and we were awarded the contract.
So another question along with that, are most of Minnesota's wild rice beds then located up here in northeastern Minnesota?
Yes, yeah. There's sort of a diagonal that goes up from the cities, up to the northwest corner of the state, and wild rice is north and east of that diagonal, for the most part.
Why do you see this research being important? Do you see it perhaps helping to shape policy in Minnesota?
Oh, definitely, definitely. The PCA is using this data now in their standards and our experiments. And in fact, PCA scientists come up and take additional samples out of our experiments, which are at the UMD experimental farm out on Jean Duluth Road. Is where our experimental tanks are.
Is there more research coming, or is this the end of it now?
No, we just submitted a proposal to the National Science Foundation for a couple years of funding to look at the iron sulfur geochemistry, a little more basic research.
Well,
and
we hope you'll keep us posted, keep us updated.
Yeah, no, we plan to continue this. There's a lot of interest.
All right, Professor John Pastor, thank you very kindly.
Thank you.
Appreciate it.
Thank you.
Thank you.
Now, let's dig into our news file archive for a look at what was making news 25 years ago this week.
Just by looking at the new Superior Public Library from the outside, you get the feeling the new facility has a lot to offer. But when you walk through the doors, you get the full surprise.
I think they're going to be awed by how much there is and how nice it looks compared to the older building.
A group of Superior Elementary students had the honor of going on the first tour of the building. They gave the new children's section thumbs up.
Well, I like the dragon hanging up on the ceiling, because it has all the books in order and you can go and find nice books to read.
This afternoon's dedication ceremony was a milestone for some. Handicapped individuals were chosen to cut the ribbon, the same people who may not have been able to utilize the old library. The new facility is far more user-friendly for the handicapped. Not only is it wheelchair accessible, but it has closed caption television and communications devices for the deaf, and this color video magnification system for those with poor vision. The library also contains an historical research library and archives, an extensive audio-visual collection, and if you're an art lover, you can check out a different painting to hang in your home every week. In Superior, Laura Cowan, KDLH News.
Proctor School District residents will vote next Tuesday on an athletic facility referendum. Proctor School officials decided to ask district residents to pay for the facility improvements after funding requests for state bonding money were denied. The $12 million referendum would pay for a new multi-purpose arena and other athletic facility upgrades. And joining us with more information is John Engelking, Superintendent of Proctor Schools, and thanks for being here.
Well, thank you.
John, tell us how the money would be spent and why it's needed.
Well, we're asking our voters to approve a $12 million bond, and about $9 million will be used to build a multi-purpose arena, and then about $1.4 million will be used to fund an artificial synthetic turf at Eggerdahl Field, our main football and baseball field.
Mm-hmm.
When you say multi-purpose arena, John, what else would be in there other than a hockey rink?
Yeah, sure. Well, we really want this not just to be a sheet of ice, and so our intention is to provide a community room that can be used both by our community and with our school and students coming in to use it. So we envision maybe a seating capacity of maybe 400 in that community room, and we just think it's going to be some opportunities.
Why is a new arena necessary?
Well, I'm glad you asked, Danny, because our current arena is 45 years old, and when this arena was built, it had a projected life of about 30 years, and so we're 15 years past. And the roof leaks, the ice heaves with the frost. We've got ratchet belts holding the boards up. It's
tough shape?
It's in tough shape.
Mm-hmm. And the school district has put together a video on the project. We do have a piece of that we could watch right now.
Oh, sure.
It's just about 45 years old. The slab goes up and down with the frost.
Then the boards twist and turn, and there's gaps in the glass, gaps in the boards. We've used ratchet straps to tie them down and try to secure them.
On February 7th, voters in Proctor will have the opportunity to decide on upgraded athletic facilities, including a new multi-purpose arena and installation of synthetic turf at Eggerdahl Field. Funds would also support athletic facility upgrades in Kenosha, Grand Lake, Solway, and Midway Townships.
You know, this referendum is more than just a new hockey arena. Having turf at Eggerdahl Field will also help our youth sports teams to be able to play.
Football, lacrosse, softball, baseball, I mean, everybody's going to get a chance to get opportunities out of this deal.
The owner of a $150,000 home would pay less than $4 per month or about $47 per year. Get the facts about the upcoming referendum by visiting the district website. And remember to vote on Tuesday, February 7th.
It's fine. So, John, why is it important for a district like Proctor to have state-of-the-art athletic facilities?
The community as we look at our buildings, and certainly we prioritized our school buildings first, and we rebuilt Bayview Elementary. We had an addition to Pike Lake Elementary. Our facilities, our educational facilities are where they are. But in addition to education, communities really attach themselves to their athletic teams. It's that identity that gives communities, and we need to instill some pride in the facilities that we have.
Superintendent, can you talk to us a little bit about what kind of a increase in property taxes and how that would impact homeowners and businesses in Proctor?
Sure. The average or the anticipated tax increase on a $150,000 home is about $46 a year. So it's not a lot, especially when you look at the need.
Do you see an economic benefit to the community having this new facility as well?
Yeah, I've had business owners in the community say, John, this is really important to the economic growth of our community as well. I mean, we're planning on building this 1/2 mile off 35W on 40 acres that we already own, the school district already owns. It's a relatively new development, so we think it'll be a catalyst to things to come.
Where will this be located in comparison where the current arena is?
All the way across town.
All the way other side of town?
Yeah, yeah.
And the old arena, I understand, is that owned by the Fair Board?
It's owned by the Fair Board, yeah.
Will that still be used for other purposes?
Or
not by the school district?
Not by the school district. In fact, our lease is up in September of this coming September. And so what do? We might have to do a short-term lease, but we need to do something, and we really hope that this is a successful endeavor.
Is part of this due to competition for students? With open enrollment, parents have lots of options and choice in terms of where they send their kids. Are you competing with the other districts around you, like Hermantown and Duluth?
I think a lot of people think that that's a valid concern, and certainly when we look at building programs, we want to have the facility that can support those types of teams. So I don't think it'll have a negative impact if we build a new arena. In fact, it'll do a lot to enhance the stature of who we are as a district.
Should the referendum pass, John, how soon would construction start, and when would you plan to be into the building?
Well, if we have a great spring, we'd start as soon as we can, and if we were optimistic, we'd be playing in the playoffs next February.
What are you hearing from residents of the district? Is this a tough sell?
Yeah, nobody likes new taxes, but I think for the most part, we're hearing a pretty positive response. Anybody who goes to our hockey arena and steps in there, if you've ever been, you'd say, really, you should do something about this, and that's what we're doing.
Are there other funding options if this falls through?
We'd have to go back to the drawing board. We really would.
You went the bonding bill route, but that didn't work out.
No, yeah. I mean, I've testified in front of the House bonding committees.
Yeah.
Our kids have, and it just hasn't been what we'd hoped for.
All right. Well, Superintendent, thank you so much for coming in and sharing the information. We appreciate it. Good luck as you go forward.
Well, you bet. Thank you.
All right.
Thank you very much.
And the election's on Tuesday.
It's on Tuesday.
All right. If you've seen a lot of folks wearing red clothing today, there's a reason. The first Friday of February has been designated Wear Red Day by the American Heart Association. It calls attention to heart disease and simple steps women can take to lessen their risk of heart attack and stroke. And here with more is Dr. Mary Boylan, a cardiothoracic surgeon at St. Luke's Hospital in Duluth. And doctor, thank you very much for coming in. Appreciate it.
Thank you. Pleasure to be here.
Thanks for wearing red.
Right. Likewise.
What are the primary causes of heart disease in women?
So the primary causes of heart disease, and mostly when we talk about heart disease, we talk about coronary artery disease. The primary causes are the same in women and in men. They manifest a little bit differently. So the things that we think about as risk factors are things we can't control. So we can't control family history, so genetics, if our parents and everyone else we know in our family has heart disease. So genetics is one thing. High blood pressure, cholesterol, diabetes, and then some other risk factors such as physical activity, weight, smoking is a big one. So those are the commonly considered risk factors.
Doctor, what are some of the symptoms of a heart attack?
That is a great question because, if you watch a lot of these TV shows, you think a heart attack is where you're clutching your chest and trying to loosen your tie. Well, that might work if you're a man, but for women, the symptoms it does, you're right. And a lot of times women don't have such dramatic symptoms. A lot of times they'll have fatigue or achiness or shortness of breath, and what happens in people who are a little bit older and they think, I must be out of shape, I must have done too much work, things like that. So it can be subtle for women, their symptoms, yeah.
If heart disease is in a woman's family history, at what age should she really start paying attention to heart health, and what types of tests should she have on a regular basis?
That is a great question because everyone thinks, well, I'm not old enough yet, I'm going to wait. And actually, we should all, from young on, every college student should know, whether it's a woman or a man, they should know their blood pressure. They should know if they have diabetes. They should know what their cholesterol numbers are. So it's really never too early. Even in kids, we should look at kids. I mean, today, a third of all children are overweight. So it's never too early to start. And a lot of times, women don't end up manifesting or having a heart attack until probably about, 60s, later 60s. And for men, it's usually about in the 50s when they start showing up with heart attacks.
Is bypass surgery being replaced by newer surgical procedures?
So I'm a heart surgeon, as you know, and I'm glad to say that heart surgery and bypass surgery remains a mainstay of treatment for coronary artery disease. So there are new medicines and new drugs and things that can hold coronary artery disease at bay for a while. And when we have to do interventions, we have many options in terms of coronary stenting that our cardiologists do. But the basic rerouting and revascularization is what we call it. The basic bypass surgery is a mainstay of treatment for coronary artery disease.
So why do some patients have stents and others have bypass?
So we fortunately have lots of data on it. So we have good guidelines to look at. For a patient who has a weaker heart, diabetes, multiple vessels that are involved, those are patients who are often better treated with bypass surgery. If it's just one vessel and it's something the cardiologist can go in and we can put a stent in there and pop that vessel open and avoid a surgery, then that's a very good option too. So we look at the person's age, their risk factors, how will they tolerate an operation, what is a better option for them? Are they able to tolerate the medications that they need to be on after stenting?
Can you talk about some of the specific lifestyle choices that people can make that would reduce their risk of heart disease?
So the good news about this is almost 80% of heart problems can be modified or avoided. So the American Heart Association has their website, and they have Life's Simple 7. So it talks about what we can do in our every day to make a change. So number one, don't smoke. So very few absolutes in medicine. Never smoke is an absolute in medicine we can all take to the bank and rely on. Managing weight, being physically active. So managing weight, being physically active, activity, knowing what our cholesterol is, keeping it under control, diet, if we have diabetes, managing it. So those are things, and the great news is improving any one of those reduces risk.
Can the same factors cause a stroke?
That is, that is exactly, it's the whole big picture, because we think of it as cardiovascular disease. So a lot of times we focus on the heart, but a stroke is the same disease process, the same disease in the vessels, except it's the vessels that go to our brain.
Mm-hmm.
So if you have a clot in a vessel on the heart, you have a heart attack. If you have a blockage in a vessel to the brain, we have a brain attack or a stroke.
And we just have a few seconds left, but I know you wanted to mention the March 1st luncheon.
Yes, yeah. So every year, American Heart Association has a Go Red for Women luncheon to really get the word out. And this year, it's this March 1st at the deck. And there's a website to contact. It's a great way. A lot of women come. They bring their spouses. They sometimes bring their kids and learn a lot about how to get a better, healthier life.
Wonderful.
All right. Thank you very much, Dr.
Thank you, Doctor.
Thank you.
Appreciate
A pleasure. Absolutely.
I was.
Well, it's time now for the week's top business stories from Business North. Blandin Foundation is providing a $650,000 grant to Grand Itasca Clinic and Hospital in Grand Rapids for a new cancer center. There is currently one oncologist treating patients at Grand Itasca, which is in the process of recruiting another. The full-time oncology staff is being recruited in partnership with Fairview Health Services, Grand Itasca's recently announced merger partner. Construction of the $4 million project will begin this spring and be completed by the end of the year. About $2 million will be provided by Fairview, with the rest coming from a fundraising campaign.
At a primary election forum in Superior Monday, the 4 contenders for mayor said economic development is a key concern. 2 abandoned big box structures once occupied by Target and Kmart will be filled in the not-too-distant future, according to candidate Brent Fennessy. Jim Payne said Superior is becoming a more vibrant place, which will attract more businesses, and he pledged to formulate a 30-year plan for the city. Kaylee Hermanson said more tourism would help the city, but said the focus should be on attracting companies that pay living wages. Mike Herrick disagreed, saying all jobs would help Superior and its residents.
Integrity Health Network has resolved a contract dispute with Blue Cross and Blue Shield of Minnesota. In November, officials of Integrity, which represents more than 20 independent clinics, said Blue Cross eliminated them from participating in the insurer's network effective on February 1st. Well, on Monday, both parties welcomed the new agreement, saying they share the same goals. For more on these and other stories, visit businessnorth.com.
Call now if you have a comment on this week's show. Dial 218-788-2849 to leave a message, or send an email to almanacnorth@wdse.org. And visit the WDSE website for the latest program listings, updates on your favorite PBS shows, and news about upcoming station events. And any football fans are looking forward to the Super Bowl Sunday. Will you be watching?
I'll be tuning in for the commercials.
That's what I do too. It's like football. Is
Then
there
I'll
a
go
game
for a
going
walk.
on? For Denny and the crew here at Almanac North, I'm Julie Zenner. Have a great weekend.